Oh, you're here. Let's learn about whooping cough. Some fun facts. It was first discovered in 1906, and it is most severe for babies just because their immune systems are so undeveloped. And it can last for 10 or more weeks, so it's sometimes called the 100-day cough. And I thought it was really interesting that you can receive the vaccination while you're pregnant, considering there's so many things you can't do when you're pregnant, but you can get vaccinated, which is like exposing yourself to a disease. I mean, this vaccination is inactive anyways, so that's not necessarily a problem here, but it just sounds odd. And it's actually most beneficial for you to receive the vaccination while you're pregnant so you can provide more immunity for your baby. The transmission is airborne and direct contact with nasal discharges, so like coughing and sneezing on people, or like sharing breathing spaces with people. So that's really just like when a mother or anybody is holding a baby that might have it, and they can like breathe on the baby and transmit it that way. The route is mucosal, so you're going to breathe it in or touch your face or your eyes or your nose, etc. And the reservoir is only human. So the causative agent is Bordetella pertussis. It's a gram-negative bacteria and has a coccobacillus shape and is approximately 0.8 nanometers by 0.4 nanometers. And another interesting thing I found out was that, so there are like 4 phases of the development of the bacteria, and so it's like virulent in phase 1, and it can mutate itself to be non-virulent by stage 4. So I thought that was kind of odd. It comes from this family, which I cannot pronounce, and Bordetella is the genus for all these other ones. Pertussis and parapertussis is the whooping cough that we see in humans, and these other respiratory infections, like bronchi, septica, avium, and Hinzi or Hinzi, are really only found in animals, and like rarely seen in humans. I know that these 2 were seen in poultry specifically. And just because you get pertussis doesn't make you immune to these other ones. But like I said, they're not really common in humans, so it's not something to really worry about. You can develop symptoms as early as 5 to 10 days, or it can take 3 weeks to like develop symptoms, but it normally shows up as a cold within the first 1 to 2 weeks, and that's why it's so hard to diagnose, because it just looks like a cold or similar to other respiratory infections, and it's just not common to test for it, or it wasn't at least. You're most contagious for 2 weeks after your cough starts. So your cough can develop into the paroxysms, which are just coughing fits, which is where the whooping comes from, because you're expelling all of the air out of your lungs by coughing so hard, and you have to like take deep inhales, which sound like that whooping noise, in order to keep breathing. And sometimes you can, it can cause you to throw up during or after those coughing fits, and both of those just lead to exhaustion. It's way worse in babies just because their lungs are so small and they don't have much immunity built up. They don't even always cough, and they just turn blue, like, because they can't breathe, which is kind of frightening. More than half of babies under a year have to get hospitalized just because they like don't have any immunity to fight anything yet. It's most dangerous for babies that are under 6 months. It can also cause like some uncontrollable shaking and apnea, which is just long pauses in your breathing, which can be life-threatening to babies because their lungs are so small. Like really severe cases can lead to some brain damage, and 2 out of every 100 do not make it. And in this picture, you can see that this little boy's blood vessels in his eyes popped because like of the coughing fits, and he was coughing so hard, and it also caused that bruising around his eyes. So as you can see, it normally affects the 1-year-olds the most, or those are the most reported cases, because it's they're so much more susceptible because their immune systems are still developing. During the first 2 months, they only have the passive immunity that they receive from their mothers. So that's why it's so important to get that vaccine. And a lot of cases go undiagnosed. So that's why we see a rise from 1990, because there's just increased awareness and improved diagnostic testing as well. It's normally treated with antibiotics. And it's really important to determine the duration of your cough in order to diagnose it better. And we normally see around 24.1 million cases worldwide per year, and about 160,000 deaths in children under 5. And recently we saw a peak in 2012 with 47,000 cases. So the vaccine was discovered in the 1940s, and it stands for diphtheria, tetanus, and pertussis. The A is for acellular pertussis, which just means that it's components of the bacteria and not the full bacteria. The uppercase letters mean that it's a full dose of that vaccine, and the lowercase letters just mean that it's a lower dose of that vaccine. So the DTaP, you'll get 5 rounds of it. When you're younger, you'll get it at 2 months, 4 months, 6 months, between 15 and 18 months, and then your last round is when you're 4 to 6 years old. When you're pregnant, you're recommended to get it after your 26th week of pregnancy, just so the baby can start developing that immunity, that passive immunity through you. It's an inactivated disease, and more than 200,000 children used to get it per year, but that number has decreased because of vaccines, and the CDC recommends that the vaccine is the most effective way to prevent whooping cough, just because it's so easy for adults to transfer it to babies because they have such a harder time fighting it. So it's like our responsibility to make sure that we vaccinate ourselves, like if you're planning on having a baby, or even like being around a baby, like a caregiver or something. So yeah, that is all you need to know about whooping cough. Bye.